All right, guys, welcome back. We are having our Medical Monday interview this morning with Kristen Ankrum. She is the stroke program coordinator at Coliseum. Kristen, we're talking signs and symptoms this morning, just kind of creating that awareness for stroke as we're in National Stroke Awareness Month.
Yes.
Appreciate you waking up with us.
Thank you. Thank you.
What are some of those initial signs and symptoms that people could be aware of and say, oh my gosh, I think I might be having a stroke?
So I like to teach the community to think FAST, because FAST is an easy acronym to remember the signs and symptoms of stroke. So F is for facial droop, and A is for arm weakness, S is for speech, any speech problems. So any sudden onset of those things. And then the T is for time to call 911 as fast as possible. You don't want to wait to call 911. You want to call as fast as possible. The treatment time is limited. So all of those symptoms, any sudden onset.
What symptom comes along first? Is there that first thing that happens and then they just progressively get worse?
No, every stroke is different. You can have typical signs, whether it be, one side that's paralyzed.
Yeah,
you can have
crazy.
sudden onset of dizziness. You can have a sudden terrible headache. You can have just the slurred speech. You can even just have sudden numbness or loss of feeling on one side of your body. So
Yeah, I'm glad you mentioned that. It's not something to just sit there and wait and it'll go away.
No.
You need to do something about it immediately and call
Right.
somebody. Are there any individuals that are more likely to have a stroke?
There are. So people with high blood pressure, high cholesterol, those are some risk factors. People who smoke, those are some high risk factors. Those are some modifiable things that you can change, you can watch out for. But people that, if you have a genetic predisposition, you have family history, if you've already had a stroke, it puts you at higher risk for having a stroke. Anything like a heart dysrhythmia, you want to make sure that you're taking the medications that your doctor prescribes for those things. So those put you at risk, and those are certain populations that do have higher rates of stroke.
Yeah, real quick, Kristen, before we talk about this event on Saturday, if somebody's having a stroke and they get rushed to the hospital, they come to Coliseum, what's the treatment like?
Treatment like you're going to have a CT scan. We're going to look at some different things to see if you're eligible. So there's 2 approved treatments for stroke, but they are very time sensitive. So you want to make sure that you get to the hospital. First is a medication. It's a clot busting drug. There is criteria that you have to meet in order to receive that medication, but the FDA has only approved that drug to be given within 3 hours of the onset of symptoms. So it's a very narrow time window, and it's very important that you don't wait to get to the hospital.
I know you can't emphasize that enough.
Yeah.
Real quick, Kristen, I want to get this out there. What's happening Saturday?
So Saturday we're having a celebration for our stroke survivors. It's called the Stroke Stroll.
Nice.
This is our 2nd year that we've done it.
Cool.
So we just really want to invite the community to come out and make sure that we're celebrating our stroke survivors, those patients and those people that have actually survived a stroke. Get out, enjoy the weather. It's at Amerson Park at 9 o'clock on Saturday.
Okay.
And we want to encourage the exercise, and it's a walk. It's not a race like the 5Ks and everything.
It's fun. It's fun. And we'll put all that information on our website, 41NBC.com. Appreciate you coming on, Kristen.
Thank you.